Just some questions on the antimicrobial resistance subcommittee. It's a question or an issue I've pursued through some of the other agencies. The reason for me asking this is we have a real issue that some authorities are saying by 2030 we might not have treatments for simple illnesses like pneumonia, and in fact a simple operation like appendicitis might not be possible because of this issue around antibiotic resistance. So it's something I'm very keen to pursue. I'm aware that the committee, the terms of reference of the committee's essentially just been signed off. Just some questions about how many staff are available to support the work of the committee.
Well, good afternoon. It's Dr. Michael Smith. I'm the Clinical Director with the Australian Commission on Safety and Quality in Healthcare. We currently have a Program Manager responsible for healthcare acquired infection within the Commission. This is Marilyn Cruikshank. The committee sits under her responsibility. We have 2 staff who, on a part-time basis, actually support the work of the committee along with their other work, in addition to Marilyn's involvement with the committee. So
what sort of EFT hours are we talking about dedicated specifically to supporting the work of the committee?
I'd have to actually take that on notice to get you specific hours, because the committee has really met only the once. There were 2 preliminary meetings of the members who are currently now formulating most of the committee, but the committee itself has met once, and I think I would be anticipating something along the lines of a few hours a week at most.
Okay, all right. Perhaps if you can give me a more detailed answer, but that's helpful. Thank you. Is it right to say that the committee's only been funded until June of next year?
Certainly, the funding that the Commission is providing to maintain the committee is through until June of 2013, and the subsequent funding is yet still to be decided. Okay,
so I suppose they've got a very big mandate. They, in particular, need to develop a national strategy to minimise antibiotic resistance, as well as developing a comprehensive national antibiotic usage surveillance system, it's fair to say. The expert committee that was established in 1998, JEDICAR, as a result of that, we saw an expert subcommittee called EAGAR, with essentially the same mandate to provide independent scientific policy advice on antibiotic resistance issues. And then in 2003, we saw the development of a national surveillance, antibiotic resistance surveillance strategy. That went nowhere. Why is this going to be any different? I mean, it's only, you're talking a couple of hours staff, talking about a committee that's funded till the end of next year. I mean, we've been through this before. We've had essentially a group of experts develop a strategy. It went nowhere. We're back to where we started from, getting a group of experts together to develop a strategy. I've got no confidence that, in fact, the work of this committee is going to lead to any meaningful change on the issue.
Yes. Look, I think the Chief Medical Officer is the chair of the committee that this committee reports to, and I might actually ask him if he has comments to answer your question.
I think
that's called a hospital handball, I think.
Yeah, I think he's already commented, actually. He can get more if he wishes.
I think there's a couple of things to add. One is over the last decade, this issue of antimicrobial resistance, both nationally and internationally, has gained a significantly higher profile, Senator. So the understanding that this is an issue that's required to be addressed is certainly much higher. If you look, for example, at the work of the National Prescribing Service and its work now with the community and with general practice that's been underway during the course of this year, that was work that wasn't undertaken 10 years ago. We have the National Antimicrobial Utilisation Surveillance Program, the Australian Group on Antimicrobial Resistance. You go to chemists now and you see signs about the issue of, do you really need antibiotics? So the environment has changed. There are far more activities, Senator, than now that are taking place and took place 10 years ago. And there is a much broader understanding of the issues, I think, of communicable diseases and of antimicrobial resistance and of hand hygiene now amongst health ministers than there would have been 10 years ago. So the environment's changed. The World Health Organisation is taking this on as a major issue. We have antimicrobial resistance weeks. We cannot ignore this. And I think what we've seen is a lot of preparatory work for what is now quite serious work going forward. I would also say that the work on developing the strategy that I mentioned earlier is being accompanied by $100,000 to develop the report for the antimicrobial resistance plan. So serious funding has gone into this, Senator.
Senator, your time's up.